I don't think most men understand what a mammogram really is. Can you, if you don't mind, explain that? Because guys have no clue, I don't think.
No clue. Well, a mammogram is a radiographic picture of a woman's breasts, and they do different views of that. And so you're getting, lots of radiation for each view that they take, and they squish you down into a little, to try to get a best picture of your flattened out boobs to see if there are, any discrepancies in that. It's a lot of radiation, and they're having you do it yearly, which is bizarre. And the other thing about that is that, radiation causes cancer. So you're going there to do it, every year. Some people go more if they've had cancer. They go back and have more mammograms. They might do, it every 6 months. What I have been doing the last 4 years is I have thermography. Thermography is heat censoring, which can detect, something that's starting even before like a mammogram would. And so I actually I started with just doing my breasts, but I actually go once a year and I have a full body scan. And the woman that does it is a nurse, and she has a clinic, and she is very good at what she does. And then it's sent off to professionals who read, thermography reports. And then I get, a big report back after they've all, looked at it. So, and that's very much less invasive than, having the mammograms. Because I was diagnosed, I actually had surgery. It'll be 5 years ago, the end of this month. I had, the tumor removed.
Right. And then,
and if I'd have known, because I had, you've just had a mammogram and there's a suspicious place. We need to do a scan. We need to do this. We need to do that, and then they stick you with Novocaines and things like that to do a biopsy. And it's just so invasive and so demeaning, to have to go through all of that.
But that's the protocol.
That's a protocol. That's the protocol, and that's what I started on. So when it came back that I was positive for cancer, okay, well, let's have the tumor removed. That's, that was just what I knew. So my oncologist, I was traveling between Virginia and here in Kansas. So I had an oncologist in Virginia. And I said, look, I'm moving. I need, some recommendations for something out here in Kansas also. So I did get some recommendations by the grace of God, because my oncologist in Virginia was like, you've got to start radiation. You've got to start it now. Your window is closing. We've got to get you on a program now. And along with that, you need to be taking, hormone replacement therapies. You need to be doing this and you need to be doing that. And I'm like, whoa, wait a minute. So I come back out to Kansas, and I get introduced to she is a breast cancer radiation specialist. So I go to her to have a consult, and she says, do you know they can test your tumors? I said, what are you talking about? She says, no, there is a facility that tests your tumors and will let you know, what protocol should be or shouldn't be. And I said, wow. Really? She says, do you want to do that? I said, well, of course. So she got a hold of my oncologist in Virginia and got the tumor sent to the facility. The doctor calls me back. The breast radiation physician calls me and said, okay, your results are in. I believe I know what your decision is going to be, but here are your results. You have a 7% chance of this coming back if you do the radiation protocol that they're asking you to do and all the meds. You have an 8% chance of it ever coming back if you don't.
Oh
So,
This interview should have both your pictures in the front cover. This is unbelievable. Like,
yeah. So then
just think about this. Think about this. Protocol. And then Debbie went on to have a conversation with the physician's
assistant through my other oncologist that was here in Kansas, who is recommending me. He's like, oh no, you got to do this, you got to do that. So it was, at the beginning stages of COVID, they weren't seeing patients, so they we did a Zoom. And what I had done is, when I was in the office at one point, is I got all the inserts from all the medication that they wanted me to be on. Frank highlighted it all and went through it with a fine-tooth comb. So we get on a Zoom with the PA, and she's like, well, they want you on this we want you on this. And I said, okay, I know. And and she goes, and these are the side effects. And so 95% or 98% of the women that are on this medication have this side effect. So we're going to put you on this. We're going to add this to it. It was just a long list. And I said, okay, so one medication you want me on leads to this side effect, and you're giving me another medication to counteract it. Yes, that's what we do. The side effects were absolutely ridiculous. I mean, They were, and when it says, on the bottom, it says, can cause death. You're like, okay, great.
We went through this because it was a good exercise to go through it. And she was very, very complimentary she says, of all the people that I've had interactions with protocol references and what may or may not be, you guys are the most educated to or had questions to, and you also